read a lot of books. And at that point in my life, I read most of Herbert Shelton, whose work in the natural hygiene movement. It was an organization called the American Natural Hygiene Society, or the National Health Association back then, that advocated mostly not eating natural plant foods in large quantities, big salad, nuts, beans, and trying to reduce processed foods and animal products. It wasn't, they had a lot of crazy things they also advocated, but of course the diet was clear that these undiscovered phytonutrients were absolutely essential for normal humans, which were essentially evolved from the primates and were similar genetically to a primate structure. And without a good intake of green vegetables and nuts and other things like that, we couldn't expect maximal immune system or performance. And the concept was set into place back then that getting sick was unnatural, that developing obesity, diabetes, high blood pressure, heart disease, strokes, cancer, and dementia were not the inevitable consequence of aging, and they were not natural for our species. I was learning back there, even as a teenager, that it's normal for an animal to live out its normal life expectancy without developing chronic disease, that preventing it from performing through up to its later years. And I evolved the Nutritarian diet to enable people to live to be 100 years old, which is not a blue zone. A blue zone, the average person lives to be 90. There's some centenarians, but I want the average person to be 100. We're talking about do much better than a blue zone can do. But in doing so, we enable people to have their physical capacity and their full mental capacity throughout their later life, whereas a person in America who maybe lives to be 80 still has such a deteriorating quality of life between 70 and 80 years old that the last 10 years are living in suffering. So we're talking about living to 100, where you're actually living to 98 or 99, having a great active physical life. And that's what I think these advancements in modern nutritional science make possible. And now we can actually look at also some of the deficiencies or flaws in the vegan diet. And my experience over the last 30 years, which I've cared for a lot and mentored a lot of the people and physicians who were actually established the natural hygiene movement in the American Vegan Society from the early 1950s and 60s, who, as they became elderly, developed certain problems like dementia or Parkinson's due to fatty acid, DHA deficiencies or B12 deficiencies. So I could look back and see, okay, what were these people missing? Doing the blood test, and actually with the ability to supplement conservatively in conjunction with a plant-based vegan diet that's very nutritional, rich, and complete, we can enable people to have the best possibility to live a disease-through life, and also to reverse disease if they have something wrong with them.
Mm-hmm. You've been reading about nutrition for a long time. You just mentioned that your philosophy you've learned has changed. How has your food philosophy changed in terms of how we can get the optimal diet for longevity and good health and recovery?
Well, okay, I'd love to answer that question, but I have no philosophy. Philosophy means there's some kind of agenda you have that you're trying to promote, and you're trying to get the science to fit that agenda or philosophy. I just go where there's the overwhelming amount of evidence. In other words, I want to just let evidence and science and clinical, empirical evidence of working with thousands of people shape the direction, right, of where we're going. So I have no predetermined agenda or desire to be plant-based or anything. Years ago, I was even thinking a little bit of fish would be okay in the diet. And the reason why I've modified that more in recent years is because of the pollution of the oceans and the dumping of so much plastic and garbage in the ocean that even the small fish like sardines and scallops and any kind of mussels are now contaminated with microplastic, and people have microplastic in their body. And I don't even recommend brown rice at this point, because brown rice is contaminated with arsenic because of the way we're using chicken manure. And also we're growing rice paddies on cotton fields on prior years where we've used also kind of chemicals on them. And rice, the husk of brown rice, very effectively sucks arsenic out of soils and concentrates it in the kernel of the rice. So I use other grains like quinoa that aren't, that are grown in better, safer soils, and also not as arsenic attracting as brown rice is. So in other words, yes, a lot of it. This is not philosophical based or even ethically based. Mm-hmm. It's just based on what's giving people most performance and most ability to get well and reverse disease.